At any point in the last 12 months, were you worried about whether you would run out of food before you could get the money to buy more? Do you have both financial and physical access to safe and healthy food? Is your nearest grocery store greater than 10 miles away from your home? Do you qualify for government assistance programs such as SNAP and WIC? And if you do, have you utilized these programs? Members of low-income families are frequently asked questions similar to these in order to assess their level of food security. Food security is defined as having at all times physical, social, and economic access to sufficient, safe, and nutritious foods that meet dietary needs and food preferences for an active and healthy life. Food insecurity is the lack of access to these nutritious foods in any capacity, whether it's due to social, physical, or economic factors. Food insecurity does not discriminate. In 2017, an estimated 1 in 8 Americans were food insecure. It can happen to any race or ethnicity in any urban or rural community. Pockets of these communities where food insecurity is the highest is known as a food desert. The USDA defines a food desert as greater than 1/3 of a population of a community living greater than 1 mile from the nearest grocery store in urban areas, and greater than 10 miles from the nearest grocery store in rural areas. Food deserts are the common physical barrier to food security in the United States, despite the fact that the United States generally has an abundant and stable food supply. When coupled with families in low-income situations, food deserts can have a crippling effect on food security. According to Johns Hopkins Center for a Livable Future, food security in a region depends on 3 factors. First, does the region produce enough food for its people? Second, is that food supply stable? And third, do the people have physical and economic access to the food? In the United States, where food supply is generally abundant and stable, the access to food is the primary concern. In an effort to combat financial barriers, there are government assistance programs like SNAP and WIC that help families gain financial ability to access food. SNAP, or the Supplemental Nutrition Assistance Program, formerly known as food stamps, is an income-based assistance program mandated by the federal government through the Farm Bill. Through this program, roughly 42 million Americans had increased financial access to food in 2018. In Montana, 121,000 residents, roughly 12% of the state's population, received SNAP benefits in 2018. SNAP was created to combat food insecurity by providing supplemental assistance to those in financial need. Another program with a similar goal but different guidelines is Women, Infants, and Children, also known as WIC. This program allows expecting mothers, breastfeeding mothers, and all children up to the age of 5 additional assistance for food. Women and children on Medicaid or already utilizing SNAP benefits automatically qualify for WIC. That makes this program even more inclusive for the population of people that it needs to serve most. These policies and programs, among many others, continue to be controversial among evolving political climates. The concept of food equity is one that lends to that controversy. Food equity is the idea that all people should have and are entitled to access to quality, nutritious foods, regardless of economic status or location. A world with true food equity would be a world without food insecurity. However, food equity feels unattainable because of the amount of change that would need to take place to make it happen. Although food insecurity does not exist in isolation, the main root cause identified for food insecurity is poverty. Families in poverty and low-income families are also affected by many other overlapping factors, such as affordable housing, social isolation, medical costs, health problems, low wages, and many more. In America, the ones that are blamed for poverty are the poor. Poverty is viewed as a lack of character, a lack of drive and intelligence, when the truth is poverty is only a lack of resources, a lack of money. The social stigma that follows impoverished people also follows the government assistance programs set up and aimed to help those people. Food insecurity is a nationwide, it's a worldwide, complex problem that cannot be solved with a one-step change process. The changes that need to occur to solve this problem involve every aspect of the food system, government policies, and a total shift in social norms and attitudes. So what can we do? We can start by dismantling the stigma surrounding food assistance programs. Make it known that being in poverty and having food insecurity does not equal a lack of intelligence or drive. It is simply a lack of adequate resources. So be the voice that continues to support providing resources. Make an everyday and every minute choice to be curious instead of judgmental of a person's situation. Food is a fundamental expectation of being human, and the face of hunger in the face of food insecurity is fluid. Encourage positive change at every avenue and make your voice heard in legislation so that we can feed the people of the world and live in a home where food equity and food security is not only possible, but true.